Hi, Steve from Wandsworth Physiotherapy here. So you've twisted your ankle or you've pulled your hamstring and you're wondering what you need to do for the first few days to manage this problem. So there's three things you need to do. The first thing you need to do is use rice, and then we'll talk about which medicine to use and doing no harm. So rice stands for rest, ice, compression, elevation. Most people have heard of this. So you need to rest the area relatively, take the weight off your feet, go about your normal daily activities, but don't do anything beyond that. And if you've really badly hurt yourself, then you need to rest beyond that. You might need to use some crutches or use an air cast boot if you've really badly sprained your ankle. The next thing to do is ice. So don't put ice directly onto the skin because you can get an ice burn. So wrap it in a tea towel, use a bag of frozen peas and ice the area that you've injured for 10 minutes every few hours. The next thing is compression. So if you've hurt your knee or your ankle or your elbow, you can put some tubey grip on and compress the area. And then the fourth thing, is to elevate it. So when you sat down watching the TV, have your leg up, and that will help the gravity to drain some of the fluid out of the injured area. So the next thing to do is which medicines to take. So if you've sustained an acute injury, take paracetamol because that can help with the pain. Most people also take Nurofen, but there's actually a thought now that you shouldn't take Nurofen or ibuprofen for the first couple of days because that can disrupt the quality of the new collagen that's being laid, which is your healing tissue, which is being laid in that area that you've injured, okay? And then the third thing to do is do no harm. So that, like rice, stands for no heat, no alcohol, no running and no massage. So don't heat the area because it can prolong the bleeding that you will have incurred from the injury. Don't drink any alcohol, that does the same thing. No running, which means no exercise, no movement beyond daily activities, and no massage. So don't go and get a massage if you've strained your hamstring or sprained your ankle. Come and see a physio who will be able to diagnose the problem and give you the right advice.